so much for staying with us this morning. Respiratory virus season is in full swing in the U.S. and well, health experts say we likely haven't reached the peak of these illnesses yet. Mandy Gaither goes over symptoms for each of the main winter viruses and explains why it's important to know which illness you have.
Across the U.S., respiratory illness is high. Seasonal flu remains elevated, as is RSV, with activity in many parts of the country and emergency room visits and hospitalizations increasing among children 0 to 4 years old. COVID-19 activity is currently low, but is increasing nationally.
Every year, there is a dance of respiratory viruses.
Dr. Frank Esper with Cleveland Clinic Children says all of these seasonal illnesses have similar symptoms. So when you're sick, it can be hard to know which you have. For flu, the two main types circulating are A and B. Flu A tends to be more severe with high fever, shakes, and chills, and more gastrointestinal issues, especially in children. He says adults usually have more of a cough. Symptoms for RSV include runny nose, congestion, decreased appetite, coughing, sneezing, fever, and wheezing.
It really causes problems if you have underlying lung disease, especially things like asthma or COPD, or are prone to have wheezing.
Symptoms for COVID-19 may include high fever, muscle aches, and stomach aches.
If it gets into your lungs, it can cause a really bad pneumonia.
If you're sick, Esper says it's important to be tested to know which virus you have because treating it early is key.
Viruses, once that ball gets rolling, it's very difficult to stop, even with an antiviral medicine.
And the CDC says if you have emergency warning signs like troubling breathing or chest pain, it's important to seek medical care immediately.